My name is Miracle,
I'm Caroline.
and our partner Stephanie could not make it for this presentation, but we're going to continue and yeah.
So, we're going to talk about the discouraged use of tanning beds with you guys today and just shed a little more light on why to not use an indoor tanning bed.
So, the use of tanning beds, that's the specific health threat that we're going to cover. It's called the UVR associated substance disorder. It has very addictive qualities. So, tanning beds, people who try to stop using indoor tanning beds have the same withdrawal symptoms as opioid users, which is pretty surprising and like big. Another name for it is tanorexia or tanning dependency, are the UVR associated substance disorder. Our target population that we're targeting is young Caucasian females because they're the most at risk for this disorder. 24% of 13 to 19-year olds and 37% of Caucasian women have tanned at least once. So that means that 24% of 13 to 19-year-olds and 37% of Caucasian women are at risk, not only for this disorder but developing skin cancer.
So, looking at the trans theoretical model and all of the steps, the pre contemplation, this is the people who don't think they need to stop tanning. Contemplation, these are the people who start to think, okay, what are the risks involved with tanning? Preparation, they start to think of a plan to not use the indoor tanning bed. And then action, they participate in other methods such as using self tanners as opposed to going to the tanning bed. And these other methods necessarily don't have the high risk as the indoor tanning bed. And then maintenance, they keep participating in the other methods of tanning as opposed to going to the tanning bed. So, looking specifically at our discouraged use of tanning beds, if you look at this model, again, the pre contemplation, 25% of young adults are unaware that the tanning beds are not safe. So, again, these are the people who don't think they need to stop tanning. And then contemplation, these are the people who begin to think about not using the tanning bed. And so they could think about the benefits of not tanning and then also the risks involved with tanning because there are significant risks such as an increased risk of developing skin cancers. For instance, if you tan at least once, you have a 20% increased risk of developing melanoma. And then if you tan at least once again, you have a 67% increased risk of developing squamous cell carcinoma and then a 29% increased risk of developing basal cell carcinoma. The tanning beds are also very addictive, as Miracle stated earlier, and 20% of Caucasian women did show signs of being addicted to the tanning bed. Preparation, again, starting to think of a plan not to use the indoor tanning bed and maybe considering why they feel the need to tan to get really to the root of the issue. Action, participating in other methods of tanning, such as maybe self tanners or spray tans. And then maintenance, just continuing to participate in other methods of tanning instead of going to the indoor tanning beds.
Okay, so I'm going to be doing the health belief model. And so the perceived susceptibility, that just means like young, our target population, how they perceive that they're at risk of getting this, the UVR related disorder. And young adults don't think that the indoor tanning bed is harmful. In fact, most believe it to be a safer option. They don't think that this tanning bed is harmful. They actually feel that it's relaxing, a healthy feeling. They feel as if they look better. Some feel that indoor tanning helps them avoid burning. Perceived benefits, they feel like indoor tanning bed options decrease their risk of skin behavior. Um, Perceived negative, I feel like the perceived negative is a self esteem issue. So that basically means people who use indoor tanning options probably have self-esteem issues, and they feel like they have to tan in order to meet societal beauty standards. And so our cues to action is required health warning for indoor tanning salons, um, an in-depth required health warning. So to like really discuss with each customer the negatives that are associated with indoor tanning, um, to improve self-image, so therapy, group encouragement, and policies concerning indoor tanning, as well as transdisciplinary collaboration. So with the mass media, with policymakers, with schools, it requires the efforts of everyone. And so efficiency as always depends on the person. But like I said, group encouragement and just a mass encouragement in general can help improve self-efficiency. So the best way to combat mass misconceptions, especially concerning indoor tanning, is with statistics. So indoor tanners actually have a 74 increased chance of developing melanoma, which is a cancerous cell. Melanoma counts as less than 5% of skin cancer, which means that out of all the cancer cell types, melanoma counts as less than 5%. However, it is responsible for 75% of skin cancer deaths, and one American dies each hour from melanoma. So the use of a tanning bed before 30, that just means like once, there's no like certain amount. Um, any use of indoor tanning bed before 30 increases melanoma risk by 75%, which is a lot. Using a tanning bed once increases the risk of melanoma development. Keys to action, as stated earlier, media, authority figure, anybody who has any kind of influence, schools, policymakers. It takes everyone to combat this particular health threat, and requiring salons to have warning materials stating that indoor tanning bed usage can cause cancer and giving the stats. And with self-efficacy, as stated earlier, it does really depend on the individual, but just letting people know that you can stop indoor use tanning, and group efforts would help in the long run.
So this is our flyer that we chose to do for our educational tool, and specifically looking at the trans theoretical model, it does apply. So if you look at the pre-contemplation, again, these are the people who do not think they need to change their behavior. So again, 25% of young adults are unaware that tanning beds aren't safe. So if they look at the flyer and see some of these stats, they could start to realize, okay, this behavior is not safe. Contemplation, again, the statistics demonstrate that tanning increases the risk of skin cancer. So again, looking at these percentages and just realizing, okay, this behavior really does have risks. Then preparation, again, thinking about other methods of tanning, so maybe using self-tanners, and again, the statistics on the flyer, such as 1 American dies each hour from melanoma, would increase the percentage of people who would stop to use the indoor tanning beds. Then we have the action, so starting to put this plan into effect, and the maintenance, which is continuing to participate in other methods of tanning. And again, looking at all of these statistics, this would start to make the target population realize, okay, this behavior is not safe, and I need to start to take steps to decrease participation of using the indoor tanning beds. So why flyers? We chose flyers because it is an effective way to market, and then it would be easy to distribute around college campuses to make sure that we're reaching our target population. We could put them in buildings around campuses, such as the healthcare building. Flyers are also very cost efficient, and the information can be easily distributed. And then lastly, flyers do appeal to younger adults.
So, our limitations on our health education campaign, the barriers are people think that tanning beds are safer than tanning in the sun. This is not true, of course. The use of tanning bed um, has a 67% chance of increasing um, the risk for developing squamous cell carcinoma and a 29 increased risk for developing basal cell carcinoma. And again, when people find out that a particular behavior is harmful, it is more likely that they're going to stop the said behavior. So our campaign with using the flyers is really helpful, but our limitations on our campaign is money, self efficiency, social beauty standards, and collaboration amongst transdisciplinary. That basically means that money, of course, would limit our efforts. Self efficiency, like it depends on the individual, how effective our campaign is. Societal beauty standards, that can be combated with therapy, of course, and letting people know that it's okay to be yourself and that there's no like right skin tone, that your skin tone is beautiful, and collaboration amongst transdisciplinary actions. Transdisciplinary. That just basically means like getting policymakers and schools and media influencers to realize that this is an issue, and so like a limitation for that is just like getting them to care about it, basically. And to monitor and evaluate how we're going to do that, we're going to continue surveillance efforts at the national level and monitor indoor tanning attitudes and continue surveillance of millennial incidence and mortality rates. That just basically means we're going to see if indoor tanning attitudes have changed during the course of our campaign. We're going to monitor the mortality rates for melanoma and see if those have decreased. We're going to continue the surveillance efforts at the national level to see if our campaign influenced at the national level. Pre-intervention and post-intervention, that just means that we're going to send out a convenience survey before and after our campaign efforts to see if tanning bed usage has decreased. Tanning bed usage is undefined, like as stated earlier. Using the indoor tanning bed once increases your chances for cancer heavily. There is no safe amount of tanning bed usage because it is carcinogen, and carcinogen is also found in cigarettes, just like there is no safe amount of cigarette smoking. And yeah.
So this is just our literature cited. So if you guys have questions or just want more information, I would encourage you to look at some of the sources that we used. And then lastly, this is just the author contributions.